want to talk about the Mental Health Parity and Addiction Equity Act.
Sure.
So just out of curiosity, I Googled it the other day because I really want to explain this to people that have heard of it but don't really know what it stands for. If you Google it, you'll probably find something like this. Mental health parity describes the equal treatment of mental health conditions and substance use disorders in insurance plans. When a plan has parity, it means that if you are provided unlimited visits for a chronic condition, medical condition, then they must offer unlimited visits for a mental health condition as well. So that's what the insurance companies are supposed to do.
Well, yeah, that's a little simplified. The rules aren't complete parity. It's not if I allow you to have 15 blood draws for diabetes, that I have to allow 15 urine samples for substance use disorder. That's not how it works. But in theory, that's what they're trying to get to. What they're trying to say is you can't put overdue financial burdens on mental health types of services than you do on medical services. Now, I don't want to get into the complexity of the law, but in theory, what you said is what they're trying to get to. I can't put treatment limitations on mental health benefits if I don't have similar treatment limitations on medical, surgical benefits. I can't put additional financial burdens, higher co-pays, higher co-insurance on mental health benefits than I do on medical surgical benefits.
How does the insurance industry either abuse this law or manipulate it?
One of the issues is simply enforcement. President Obama, before he left office last October, issued a report that indicated all of the grievances or violations of HIPAA that insurance companies are currently doing. That's everything from requesting medical necessity documentations multiple times. Okay, well, after I send it to you the first time, if you can't find it, that's a HIPAA violation and you need to notify the clients that you lost medical records. Either you have them or you don't. And so when you request them multiple times, for example, that's a HIPAA violation because you lost my medical record and you're supposed to tell me. When they deny your claim, it's supposed to be specific to who you are and what your particular problem is. They have robo-signed claim denials and that have nothing to do with your case. They're standard whether you are a cardiac patient or whether you're in substance use treatment. It's the same denial letter, and that's against parity. So there are a variety of things that they're supposed to be doing.
Are there enough regulators within the Department of Insurance to go
Oh, of course not. No. And so we've brought HIPAA violations to the Department of Insurance. We've notified the Health and Human Services Office of Civil Rights about HIPAA violations. It's just not implemented. It's just not worth the paper it's printed on because there's no enforcement. So for example, one of the great indicators or red flags with parity is if they deny behavioral health or mental health claims at a higher rate than they do medical surgical. Well, the only person that can find that out is the Department of Insurance or the Department of Managed Healthcare or the Department of Labor in California. In most states, it's just the Department of Insurance. They're the only ones that can request that information from the insurance company to find out if they're denying mental health claims at a higher rate than they are. Because that's a red flag. If you have a denial rate of 40% for mental health claims, but it's only 15% for medical surgical, what's the reason for that? How do you justify that? Shouldn't they be relatively the same? But the only person that can do that are the regulators.
So the next obvious question would be, does ATAC have enough manpower to knock on all these doors? Where are you guys with all that?
Well, what we try to do is we try to engage our members. We write customized letters for them so they can send them in to Health and Human Services and report HIPAA violations. Or we write a customized letter where they can report unfair payment pattern practices. So what we try to do is standardize things and then allow them to customize them based upon their particular situation. We're very good at writing letters that are very clear that have to be responded to.
So in 2014, the Parity Act is formally implemented. So why did it take 6 years?
I would postulate that the insurance lobby was not really interested in seeing mental health parity happen quickly. They delay. Then it was finally implemented in 2014, and now they're screaming bloody murder. And just in the new healthcare bill, the House of Representatives just passed, they're stripping out essential health benefits. So what that means is no longer does mental health have to be covered. Okay, so no longer does substance abuse have to be covered. States can opt out of that. And you know what that's going to mean? That's going to mean that someone's going to have a $25,000 to $50,000 deductible on their insurance policy for mental health. Then why bother having an insurance policy? So it makes all insurance policies around substance abuse or substance use treatment catastrophic. Because what average American can afford $25,000? And by the way, they're going to do that for cancer too. So if you have metastatic cancer, your premium could be $150,000.
Yeah, there's a lot of people running scared right now.
Right.
There's
I mean,
no
it's just crazy.
But this is going to evolve, and it still has to go through the Senate, and
Right.
we'll see what happens there.
Right. We see what happens there. But one of the wonderful things about the Affordable Care Act, which used to be called Obamacare, one of the wonderful things it did is it gave 20 additional million people health care. And with that health care came mental health and substance use treatment. And many people have taken advantage of it. And so the insurance companies are making more money than they've ever made in the history of man. Yet they're saying, oh, we're pulling out of these different marketplaces. And no one challenges them on that. You're having record profits. I'm confused.
How much money do you need to make?
Right, exactly. You're making record profits. And when they pull out, when Aetna pulls out of Florida or Cigna pulls out of Florida and leaves Aetna there, guess what they have? It's called a monopoly. And that's why they're raising the premiums the way that they are.
Right.
Because they're the only game in town. And if you think that the insurance companies don't understand that when they pull out of a market, why is it that Aetna's left in one market and Cigna's left in another market and United Healthcare's left in another market? Why is that? It sounds like it's by design.
Yeah. Is there any way of knowing what the denial rate is for medical claims versus mental health?
The only organization that can find that out is the Department of Insurance or a regulator that manages that. We can't find that out. They're not going to tell us that. Even though I will tell you that they're supposed to tell us that if we request it. The insurance companies aren't going to do it. They just don't do it.
Why? Why is that?
Because they say it's private. If you ask them, how do you figure out the usual, customary, and reasonable rate to pay someone for substance use treatment? They say, oh, that's proprietary information. We can't share it with you. The way we're going to get it is to have a judicial action.
Suddenly privacy becomes very convenient.
Right. Yes, exactly.
It's on your side of the argument. Is there anything else that the layperson would need to understand about it? What can they do to fight for it themselves? Like, let's say I'm the head of the household and my policy says what you just described, but clearly I'm not getting that in terms of my mental health benefit.
Depending upon your policy in California, if it's an HMO or the Blues, you send a complaint to the Department of Managed Healthcare. If it's a PPO plan, you send a complaint to the Department of Insurance. And if it's, your employer self-funded plan, the Googles, the Apples, the IBMs of the world, then you send it to the Department of Labor. And the more complaints that we get, whether it's from providers who join our organization and we help them to manage that process, or whether it's from individuals, that strength in numbers is what we need in order to fight against some of the behaviors of some insurance companies.
I think that's a really important point because, people hear, so I have to fill out a generic form and they think that goes down a black hole. Well, I just talked to a mother yesterday who had a nightmare navigating the insurance system. In this case, it was HealthNet, trying to get her son through treatment. And she bombarded the Department of Insurance. She bombarded HealthNet. And she rang their phones off the hook. And eventually, she was able to get some help. And she was able to get some action. So if people think this doesn't work and they become complacent, then I would think you really got to knock them on their butts because...
Right. What we're trying to say is, okay, we're going to be organized. We're going to make it very easy for you to do what you need to do because ATAC, the Addiction Treatment Advocacy Coalition, does the work for you. And so what you just need to do is fill in your information that's germane to your particular case, but we've already written the letter for you. And we know that the letter is very effective. And we've quoted the insurance code, so they know when they get the letter that these are people that know what they're talking about, as opposed to, I'm upset that they aren't doing da-da-da. Well, no, we quote the insurance code. Insurance code 724 says this, and this is why this is an issue, and you need to address that. And that's how we teach people to be a little bit more effective.